Coco, I want to hand over to you to take over the virtual session and then invite Bert Schlatter, who is the Executive Director of the FP2020 Secretariat in Washington, D.C. We're going to have an interactive session this morning with the FP2020 Secretariat. I thank you once more for being here. Coco, over to you.
Thank you so much. Good morning, everyone. I hope you can all hear me. If you can hear me, please give me a thumbs up or say yes. Coco, if you don't mind putting it in the chat box so I make sure that my audio is audible. All right. Pardon me, I have two screens here. So if I'm looking sideways, I just want to make sure I can see the chat. Can you hear me? If anybody can hear me, I just want, okay, great, awesome, thanks, Beth. Good morning, everyone. Good morning, Nigeria. It is awesome to be with you today, this morning to kick off the 6th Nigeria Family Planning Conference. My name is, oh, sorry? Okay, my name is Onyinye Ede, and I am currently the interim manager for the Anglophone Africa portfolio at the FP2020 Secretariat here in Washington, D.C. I bring you very warm greetings from my colleagues here who would have all loved to have participated in person, but due to the situation at hand, we are really excited to be joining you virtually. So I will be the moderator for this opening plenary to discuss the successes and challenges related to the FP 2020 commitments and the 2030 partnership and the recommitment process. So for the next 60 minutes, we will take a look backwards at the Family Planning 2020 partnership thus far and look ahead to what comes next. Because the big question is, it's 2020, so where are we headed? Without further delay, I would like to introduce and welcome our distinguished guests for this plenary session. So we have my colleague and the Executive Director of FP 2020, Beth Schlatter. We also have Dr. AGK on the plenary as well. He's the chairman, as you all know, of the Association for the Advancement of Family Planning, and he is also our FP 2020 Civil Society focal point. And then the third panelist we have is Dr. Kayode Afolabi, the Director of Reproductive Health Division at the Department of Family Health at the Federal Ministry of Health, whom I'm sure all of you know very well. Dr. Afolabi also happens to be our government focal point. So I would like to invite Beth to start off our presentations, and each speaker will have approximately 7 to 10 minutes to give their presentations, and then we will have about 20 minutes at the end for your questions, because we definitely want to hear from all of you. So please welcome Beth Schlatter.
Thank you so much, Onyinye, and I just want to make sure that the audio is working well. Great. Thank you, everybody. It's really exciting to be a part of this first ever hybrid Nigeria Family Planning Conference and your 6th biennial edition. Attending in 2016 in your in-person conference at that time was a special moment for me. And it's sad to not be able to be there with you all in person today to learn from all of you and to hear about your progress. I remain hopeful for a solution to the COVID-19 pandemic. And in fact, yesterday, seeing some people vaccinated for the first time is really a positive step forward. But I really do look forward to reconnecting with all of you in person someday soon. I want to thank the Federal Ministry of Health and partners for hosting this very important meeting and for all the efforts that have been made to ensure successful participation of all stakeholders and partners. Thank you for being here today during these unprecedented times, and I appreciate the innovative ways that you're working to bring us all together. I wanted to share a moment how important Nigeria has been to FP 2020 as a global partnership. The government of Nigeria played a crucial role in FP 2020 from its very inception, from the London summit in 2020. I know you all know and appreciate the central role that Dr. Babatunde Oshotomen played for FP 2020, first as a leader for all of us, as a pioneer as UNFPA, as a core convener for FP 2020. And then fostering Nigeria's initial commitment to the partnership. Onyinye, you're playing the slides, correct?
Oh, yes. Coco, can you help us advance the slides? Sorry, I think maybe we needed to give him the signal to.
That's okay. That's my fault. We'll get this
Okay.
together.
Yes, but Coco, yes, please turn on slide deck 1.
Yeah, because I don't see slides. Okay, so Coco will pull up the slides, but I really wanted to start by honoring Dr. Babatunde. I know that you all feel this very deeply as one of the leaders of your family planning program as well, but that role that he played at UNFPA in ensuring both UNFPA's central role to FP 2020, but also the partnership with Nigeria was really critical to us. When Nigeria recommitted in 2017 at the London summit, under the leadership of the former Minister of Health, Professor Isaac Adewale, Nigeria made 3 commitments. First, to ensuring sustainable financing for a national family planning program, including through a commitment of US $4 million for the government contribution to procure commodities from 2017 to 2020. Then to improve availability of services and commodities, and then to build partnerships to improve family planning success. This important role really helped compel Nigeria forward as one of the leaders in the region for family planning and helped solidify that partnership across the Africa region. Next slide, please. In 2017, the reference group for FP 2020 came to Nigeria. And since its inception in the FP 2020 partnership, Nigeria has been one of the 7 country members of the reference group. And again, the first representation early was with Minister Adewale. And then since 2019, we've been very honored to have the Honorable Minister of Health, Dr. Osagie Enire. I had the opportunity to meet with the Honorable Minister last year in Nairobi, and we are deeply grateful for his leadership and continued engagement in the FP 2020 reference group. This leadership is crucial as we determine the next steps for the partnership's future architecture. Our first youth reference group member was Margaret Balaji, most recently with NURI, the Nigeria Urban Reproductive Health Initiative. She paved the way for the reference group and partnership to incorporate meaningful youth engagement at all levels, and we remain grateful to Margaret for her partnership. As I mentioned in 2017, Dr. Babatunde advocated for the reference group meeting to be held in Nigeria. Sadly, he passed away before that meeting, which then became Dr. Natalia Khanam's first official trip as executive director for UNFPA. The community in Nigeria welcomed her with open arms. We have enjoyed a strong engagement all through with all 5 of FP 2020's focal points in Nigeria, namely Dr. Coyote Afolabi, Dr. Ajike Oje, Dr. Gertrude Odzuko, Dr. Joachim Chije, and Ms. Blessme Ajani. Next slide, please. The FP 2020 partnership is committed to addressing the policy, financing, service delivery, and sociocultural barriers to women accessing contraceptive information, services, and supplies. Over the past 8 years, governments, civil society, multilateral organizations, donors, the private sector, and the research community have come together to accelerate access to family planning for women and girls as part of the Family Planning 2020 partnership. So the slide you're seeing shows last year's figures, and we'll be renewing this slide next month. As of July 2019, there were about 53 million additional women and girls using modern contraception across the FP 2020 69 focus countries. That number is a little closer to 60 million, and we'll be launching these new figures in January, along with our new annual progress report. Next slide, please. The partnership has done more than just add additional users of contraception. This partnership has transformed the family planning community as a whole. There are 47 countries that have committed to the partnership, building on the momentum from the early commitment makers, such as Nigeria. In addition, we have commitments and collaboration from civil society, youth, and the private sector, from manufacturers to healthcare providers. This year, the COVID-19 pandemic has threatened to set back many of the gains we made in advancing sexual and reproductive health and family planning around the world, particularly in vulnerable communities. While COVID will continue to be a profound impact on access to family planning information and services, we've seen donors, manufacturers, governments, and international and national NGOs, the collaboration in order to ensure that women and girls continue to have access to family planning in the midst of the COVID-19 response. We commend Honorable Minister Onyinye's swift action on delivering a nationwide statement, and that previously imposed lockdown should not affect the delivery of essential services. The Ministry of Health has shown a swift response to this pandemic, including releasing national guidelines that address continuity of essential services, including family planning. Next slide, please. I'll now turn over to my colleagues and FP2020 government and civil society focal points, Dr. Afolabi and Dr. Ejike, to share more about Nigeria's successes and challenges as a member of the FP2020 partnership, including related to the COVID-19 pandemic. So Onyinye, back over to you.
Yes, thank you so much, Beth, for your presentation, and we apologize for the delay in the slideshow, but I think our tech team is working on it. So I would now like to invite Dr. Ejike Orji to just share with us what has the partnership meant for Nigeria, and also share some insights into the successes and challenges in terms of the FP landscape in Nigeria. So we would like to welcome Dr. Ejike Orji, or it looks like Dr. Afolabi might go before Dr. Orji. So please join me in welcoming Dr. Kayode Afolabi, our government focal point for the Family Planning 2020 partnership, to talk about Nigeria's commitments. Welcome, Dr. Afolabi.
Yeah, thank you, Onyinye, and thank you, Beth, for the presentation. No, is it me or you? Okay. Onyinye, I think I'm coming first, and Afolabi will come after me.
Okay, that was what I planned.
Let me share. I don't have any slides. Okay. The landscape of of family planning in Nigeria, I'm looking at it from two levels. One, the policy directions, and then how far have we gone with them? And then also looking at the governance structures and then service delivery, including partnerships that have been built to make sure that we move the agenda forward. As of 2012, our CPR was hovering around 10%. And then as we speak now, it's 12%. So let's give ourselves a little, should I say, a hand of appreciation that we've moved from 10 to 12. I'm not hearing you clap. At least it's not in the negative direction, it's in the positive direction. So all we need to do is to increase that. And then also the other very important component of monitoring FP services is the unmet need. We still are grappling with about 20% unmet need based on the recent NDHS in 2018. So which is quite high. But for me, it's not such a bad news because the message is going across to the women. So more women are asking. So, but we are disappointing them for not meeting their needs. If we had made that 20%, maybe we'll be hovering around 30% CPR as we speak. And we know that at the time we made commitment to get family planning up in 2012, we did say 36%. But the immediate past Minister of Health, Professor Isaac Adewale, had looked at the trajectory of how we're going to meet that. And he said in very good mind that we should try and rebase. So we rebased to 27% by 2020. But unfortunately, we didn't make it, but there's a lot of room for improvement, I would say. The other one is that let's look at now the policies guiding what to do, having laid out what the immediate data shows us. And mind you, when I say all this data, I'm somebody that does not like to quote national data, but be as that may, that's all I can do now. I prefer to do disaggregated data because you will see the good, the bad, and the ugly. But the important thing is that when we're programming, we should use disaggregated data, not national data. So in terms of policy direction, how has our government fared? I think we should give the government leadership a round of applause in terms of policy direction. We have a 2004 policy document on family planning, which is now being revised. But most importantly, the government has gone ahead to develop things that will make family planning move forward. And the most important document for anybody who is a player in the FP space is the blueprint for family planning, which just expired last year. Now, that has helped states to develop costed implementation plans, because we say anything you plan to spend money on, if you don't have a budget direction, that means you're not planning to spend the money. So at least the CIPs we have developed based on that blueprint. And this is why I want to applaud people like Dr. Kayode Afolabi. He's been so wonderful pushing those CIPs in the state. So we should give them a round of applause. Here also, that's where the partnership developed by the global initiative of FP2020 galvanized actions around partners, development partners, donors, to go down to the sub-national level and support states to develop those CIPs. Also, the government has shown not only policy direction, they also developed another policy that will lead to increased service delivery. If you know that we have very few doctors and very few nurses compared to our population, the government now decided to task shift and task share. So government developed a task shifting and task sharing policy, which has guided training of community health extension workers, people otherwise who wouldn't have had any play in trying to give services. So what is the government trying to do? What government is trying to do, in my own parlance, is trying to demedicalize the FP services so that women can, at the most, be able to serve themselves. And that's why you see the self-care DPMA coming into play in Nigeria. The other thing to show that government is also very, very worried. This time, I'm just talking specifically in family planning. I'm looking at how can FP help improve situations in the country. And that's why I'm now looking at overarching policy. Two things: the federal government developed the Demographic Dividend Office at the level of the presidency. That office is in the vice president's office. And that means government is trying to look at how we're going to go from demographic crisis to transition to dividend, isn't it? All of us know that that's a deliberate 20-year effort if we need to do that. So at that level, they have done that. And then quite recently, the highest organ in Nigeria that most top civil servants and the military go to spend 1 year is called the National Institute of Policy and Strategic Studies. Over the past year, the president gave them a direction, a directive, and they are being supported by one of our partners, the NFPC, to develop population growth challenges and human capital development policy driven imperatives for him. So that shows that the president knows that we're in trouble. We're in a demographic crisis. Government knows that and has given that direction that the 42nd regular executive course should focus on that. And then I really want to applaud the RPC for the wonderful work they have done. We were all part of that process. And then government has already been given that information. So these are on the policy level that has shown that government is keen. At the same time, I had a conversation with Honorable Minister last Thursday, and he told me and affirmed to me that he has directed that this money for the FP2020, 2020 budget for family planning be released. So what we're now trying to do is to monitor it. So let's give him a good round of applause. So for us coming from the civil society, talking the way that I am talking, before we are attacked, isn't it? We are the attack dog. We attack government for not doing their work. But now we say it's not attack, it's partnership. It's believing in the same cause, we're in the same boat. If you're doing well, we say you're doing well. If you're not doing well, we say you're not doing anything. We'll say, well, you're doing well, but there's room for improvement. This is what the global initiative, FP2020 initiative has brought in. So going further, we also have seen in terms of partnership, The partnership that has been developed since the FP2020 initiative
I, I think we lost audio from Dr. AGK, but I'm sure the tech team will work swiftly to bring him back with us. But thus far, he's been raising some great points about what the Family Planning 2020 partnership means, and truly in the sense of the word partnership. I like when he talked about it's not an attack on the government or what the government is not doing, but actually it's a partnership with the government. And the government has have been critical partners in Nigeria's commitments. Beth, I don't know if you want to share anything while we wait for Dr. Ichike to join us.
Thank you, Onyinye. I agree. The government of Nigeria has worked really hard to be adaptive to situations, and where we've seen successes around the world, it's because government has worked hand in glove with civil society. We all know that civil society represents the people of any particular country and know the experience of both what they need and how things can be improved. And that spirit of cooperation is one that really helps bring things forward in a way that can be responsive to the individual needs of women and girls. So that openness that Dr. Afolabi has demonstrated is really laudable and one that we believe shows the way forward.
Thank you so much, Beth. I think we have Dr. AGK back with us.
Yes. So these are the things I just wanted to share that the state level accountability working groups has been able to bring information to the governors. So we have around the states, we now have not just costed implementation, we'll have line items that speak to family planning. So I want to thank you and then yield floor to Dr. Kayode Afolabi. Thank you so much.
Thank you, Dr. Ejike.
Thank you very much, Dr. Ejike, and I also thank the FP 2020 Secretariat for setting the tone for the coming presentations. I want to recognize everyone here, especially our royal fathers at the head table and the executive of Association for Advancement of Family Planning, all distinguished ladies and gentlemen that are present here. I'll be discussing briefly the Nigeria's commitment to FP 2020. Can I have the slide projected? Does that work? I'm sure we are all aware that we made a lot of commitments at FP 2020, right from the inception at the year 2012, at the London Summit that we had in 2012, as well as the second London Summit, also that took place in 2017. Let me have the next slide. As a commitment-making country, we belong to the FP2020 initiative, a global partnership to empower women and girls by investing into their sexual and reproductive health right-based, particularly focusing family planning. And we made some commitment that we can group under three major headings. The first one was to embark on deliberate efforts to ensure sustainable financing for the National Family Planning Program. And the second was to improve availability of services and commodity. The third one revolves around building partnership to improve access. So we tried to break all this into plan of action that guided us up until this point. And we put some indicators to track them. We use the most tracker to track this commitment and the plan of action under each commitment. And what is motion tracker? How does it work? It's a customized dynamic framework that could be used to strengthen accountability and by keeping commitment in the front burner. It also highlights progress that have been made. And with this, it fosters partner participation, engagement, and ownership, which subsequently we use to address bottlenecks that could drive us towards achieving the commitments. So look at the three commitments. The first, as I mentioned earlier, was to ensure sustainable family planning financing for our program. You all recollect that the initial commitment we had financially was $3 million US into the FP funding basket. This was increased at the London Summit of 2017 to $4 million US to span between 2017 to 2020. The motion tracker adjudged us to be on track in this regard, and the fund has been contributing to family planning. The fund has been contributing to family planning commodities procurement, as well as distribution from the Central Medical Stores, Central Commodity Warehouse, across the 36 states and the FCT. Also, we assess the commitment around sustainable financing by looking through the Global Financing Facility and IDA loan. A total sum of $56 million has been disbursed to states through this platform. We also annually have been identifying a funding gap in family planning procurement, and this has been addressed on an annual basis, thanks to our partners, especially USAID, who though not contributing to the basket, but has always been there to bridge the gap whenever we have this funding gap. Also, we've been tracking resources for family planning, both at the national and state level. So using all these indicators, the motion tracker judged that we are on track. Next slide, please. If we look back at the year 2012, there was Abuja Declaration, where we also committed to ensure that at least 15% of the national appropriation will be for Earth. The motion tracker here adjudged us not to be on track at all, because we have not gotten close to this 15%. Our annual appropriation for Earth has been hovering around 4% for a number of years now. So we need to do a lot more here. I believe that a lot of advocacy will be very relevant in this situation. Next slide. So as part of our sustainable financing commitment to FP2020, we needed to put in place a functioning accountability system that will enable us to track domestic resources for family planning. This we have achieved as part of the first commitment. We have put this in place, not only at the federal level, but also across the states. And the motion tracker has been very useful to us in this regard. Next slide, please. Let's go to the second commitment. Which is taking measures that improve access and create the enabling environment for sexual and reproductive health services across Nigeria, with a view to contributing to improve preparedness and response where humanitarian crises occur. All the indicators used in this regard also show that we are on track. You all recollect that SHOPI program was institutionalized, support primary healthcare services. We still went back to assess that, whether it was done or not, even though it got aborted on the way, but it was institutionalized at that point. Then the tax shifting tax sharing policy that Dr. Ejike mentioned has been revised to include other service providers who had earlier not been captured or who had not been officially allowed to engage in practice, particularly the patent medicine vendors, as well as other community resource persons who have been contributing to community-based distribution and improve access of family planning services in the country. And we have also been able to include access to sexual and reproductive health services in the minimal initial service package in humanitarian settings. With all these indicators under the second commitment, we have been assessed as a country to be on track. Next slide, please. Still on second commitment, one of the major indicators there was to ensure that we increase the number of health facilities providing family planning services across the country. And as of 2017, just before the renewed commitment of 2017 was made, we had 9,500 service delivery points. Now we are hovering around 20,000 service delivery points. Sometimes we have more than 20,000, sometimes a little less. So we assess this to mean that we have achieved this commitment. Next slide. Still on the second commitment, DMPA subcutaneous was introduced. Of course, we all know that this is a game changer in family planning service provision across the world. So we look at what we have been able to achieve in this regard, not only that we introduce it or scale up its use within the period of commitment. Between 2018 and 2020, we have currently 7,661 facilities reporting service provision on DMPSC, as opposed to 504 that we had in 2018. And now average monthly consumption of DMPSC across the country is well over 142,000 compared to 5,537 that we had in 2018. We've also been able to train almost 30,000 service providers between 2018 and 2020. And currently, all these have contributed to DMPSC now accounting for 23% of injection method mix, as opposed to 2% that it was in 2018. We have made tremendous progress on this, and we are on track because we are still putting more efforts into scaling up the access and uptake of DMPSC, including self-injection across the country. We also committed to training at least 3,000 community health workers to deliver a range of contraceptives, including long-acting reversible method, and to support tax sharing policy by 2020. This also we have achieved. Then the third, next slide, please. Let's go to the third commitment, which is on building partnership to improve access. We are on track on cross-sectoral collaboration that was initiated by the Federal Ministry of Health and our partners to address the social-cultural barriers to family planning. Also, we're on track on dissemination of SBC messages through World Development Committee in 10,000 functional PhD centers. We have done far beyond this. The motion tracker also showed that we have been able to achieve a stronger collaboration between the Federal Ministry of Youth and Education in the developing of age-appropriate information on sexual and reproductive health, which is a good contribution to our program. Next slide. Just before I round up, what are the barriers to achieving some of this commitment that we have not been able to achieve? Inadequate allocation of sufficient resources to family planning has always been a barrier. And that's why we are not getting close to Abuja 2012 declaration. And there's overall reduction of health sector annual budget. So this makes it very difficult for advocacy to increase family planning budget, but I think we still need to sustain this. But having the bigger picture in mind of the total health budget. Some states on second commitment, some states lack support from partners. And that's why we still have some states that have not been able to really provide DMPSC as a method mix because they have not been trained. And we still have some low visibility and use of electronic LMIS in both public and private sector. Of course, private sector is always lagging behind on issue of data. On commitment 3, we need to revise the family life education curriculum, which I mentioned earlier. We have commenced this process, but it's not been finalized. And currently, there is no multi-sectoral platform that is coordinating family planning activities that involves all the necessary line ministry, especially to include Ministry of Finance, Budget, and National Planning, as well as the Governors Forum. This will be a very good avenue for us to address most of the bottlenecks we have from family planning program. Yeah. So what are the opportunities we have and what are we looking forward to? We are quite very aware of the 2030 partnership and recommitment, which we consider in Nigeria as a great opportunity to consolidate the gains of current partnership on voluntary family planning. As a country, we have been part of the multi-layered consultations that went on and led to the shared vision of post-2020 partnership. We have also been part of the discussions around the future mandate and governance structure that post-2020 partnership will likely engage on. So stakeholders within and outside government are already being sensitized on post-2020 partnership and the need for us to have a renewed commitment as a country so that we could build on the gains we are currently having on FP2020 initiative partnership. A ad hoc technical group within the National Reproductive Health Technical Working Group is currently working on issues around the commitment with a view to advise the technical working group on the best way to advise government. We have also been able to revise the our family planning blueprint for the year 2020 to 2023. We consider this as a great opportunity for us to implement our family planning program, even with faster, deeper, and greater attraction. So we're looking forward to active participation in the process leading to the redesign partnership for FP 2030 agenda and impactful collaboration before the current year 2020. Thank you very much.
Thank you so much, Dr. Afolabi. Really detailed presentation. We really appreciate hearing more about Nigeria's commitments. We know for some people, they might not be very familiar with the commitments Nigeria made in 2012 and again in 2017. But before we move on to our to Beth to discuss the Beyond 2020, I just want to highlight some of the key things that Dr. Afolabi shared in his presentation. So he discussed the motion tracker, which is an accountability system. We will hear more from Beth, I'm sure, about accountability in the Beyond 2020 partnership, because accountability really matters for ensuring that we advance family planning services to women and girls. And then also he mentioned states lacking support and the low visibility of the LMIS. So these are things that make us think about how are we carrying all stakeholders, making sure that for the next partnership, we engage as many stakeholders as possible. We take note of what are the gaps in resources and where we would need to make some extra investments. And he also talked about the need to expand and revise the family life and HIV education curriculum. I'm a very strong proponent of comprehensive sexuality education, so it's really good to hear that the government is looking at revising that curriculum to ensure that young people are getting the information and the services they need about their sexual and reproductive health. And he also talked about the need for a multi-sectoral platform. All right, and then lastly, he talked about the renewed commitment to build on the gains. I really love that he said active participation. Nigeria remains a key partner in this partnership, so the active participation of Nigeria is needed as we move beyond 2020. So with that, I want to invite Beth to give us her final presentation, which will just help set the pace for looking forward. She's going to tell us about the transition plans. And as we bring up Beth's slide, I just want to encourage everyone, for our virtual audience and those in person, to please start sending in your questions. Our virtual audience, we're going to select a couple of questions from the online community. And Dr. AGK, please, if you can help me gather a couple of questions from the in-person audience in front of you. All right, Beth, over to you.
Thank you so much, Onyinye. I want to applaud Dr. Afolabi as well. It was an excellent presentation, and we're really excited by the progress that the government of Nigeria has made in partnership with all stakeholders. So I'm going to move pretty quickly through these next slides just to share what's coming up next for the partnership. You know, we're very aware that it's December now of 2020, and so even our name is about to expire in time. But as Dr. Afolabi mentioned, the government of Nigeria and civil society partners have been working with us hand in glove really over the last 2 years to effectuate this transition that I'm about to share. So next slide, please. So again, looking beyond 2020, the Secretariat with all partners has used the feedback from this global community to refine the vision, the key focus areas, and the guiding principles for the future partnership, which make up this vision framework that you see. The future partnership will be driven by this important vision, that working together for a future where all women and adolescent girls everywhere have the freedom and the ability to make their own informed decisions about using modern contraception and whether or when to have children, to lead healthy lives, and to participate as equals in society and its development. The results statement that you see just below that in a light blue box was created by the Performance Monitoring and Evidence Working Group of FP2020 in partnership with global experts, our core conveners, and the current FP2020 Secretariat. Next slide, please. I'm going to spend a little bit of time just sharing a little bit more about that results statement because it contains some really important language. First, I want to draw your attention that we're going to be really driving for results at 3 levels, including for individuals, to ensure that they have the information about methods and side effects for a range of contraceptive choices and the ability to exercise their right to determine whether, when, and how many children they have. We also want to ensure that we have responsive health systems and that we're able to track that as well, so that we can equitably and sustainably provide high quality services and supplies for a range of contraceptive methods. And lastly, we want to ensure that we're capturing the supportive environment for policy, financing, and accountability to enable a variety or voluntary contraceptive use. Next slide, please. So we've really focused in the last few months, and again, we, like most things, lost a bit of momentum this year because of the COVID pandemic, but it did allow us as well to spend more time virtually, making sure that we have really agreement around how we're going to push forward with this next partnership. So we're going to build on the success and momentum of FP 2020 and construct the next phase to be even stronger, more inclusive, and with increased country partnership and leadership. We're drawing on the lessons from the last 8 years, and so it was really helpful to hear the reflections of Dr. Afolabi of what the partnership has meant to Nigeria's program. Because we want to have an adaptive architecture that goes beyond the original 69 focus countries and includes regional hubs with differentiated levels of engagement tailored to country needs and a transparent governance structure. And we hope that we'll maintain the kind of relationship we have with Nigeria partners, but that it'll be even closer because we'll be building a hub in the region to work more effectively with all of you. So the future structure will preserve and expand on the best of FP 2020, our convening power for the partnership, the collaborative platform that brings together diverse stakeholders from a wide range of sectors and institutions, and the dedication to high quality data and evidence. And finally, an unswerving commitment to meeting the needs and upholding the rights of women and girls. The structure will shift away. It will have important features, including a shift away from the decision-making that was US based, and again, foster regional voices and facilitate a transition to capacity, leadership, and ownership for the future partnership. So as I mentioned, we'll be looking to build regional hubs, and right now we're hoping to build 5. So one in West and Central Africa that would include Nigeria, one in East and Southern Africa, one in Asia, and then we'll be including Latin America in a meaningful way for the first time. We'll also maintain a hub in North America and Europe, likely still at the UN Foundation, but the Secretariat staff that you currently know will be reduced as we staff up these hubs over the course of 2021. And as Dr. Afolabi mentioned, our governance structure will be revised to create more transparency and inclusiveness, and will involve a broader range of stakeholders in decision-making, including country governments, civil society, and young people, and define more clearly the roles and responsibilities of each governing body within the architecture. Next slide, please. So we'll kick off this new commitment process with partners and governments in January, really on January 26th, where we officially launch the FP 2030 partnership at the International Conference on Family Planning in November of 2021. So for us, 2021 will really be a bridge year, where in January we launch our final FP 2020 annual report. We start the recommitment process with all of you, and we also celebrate the achievement of FP 2020. Next slide, please. So the guiding principles for our engagement, next slide, please, with countries will be grounded in rights-based principles. We'll be using SMART commitments, next slide, please, that incorporate lessons about success and gaps from the previous commitments. They'll be in line with content and processes for other national and global frameworks. So whatever commitments you already have, whether they be SDGs or ICPD, we ask that you incorporate those within your family planning commitment. We hope that they will adhere to accountability frameworks and review processes that are appropriate for your country context. And seeing the incredible use of the motion trackers is really inspiring here. We also expect that these will be country-led and country-specific processes with a focus on civil society inclusion. And that's not a problem in Nigeria. You all work in a way that really inspires the rest of us with the way that civil society and government are working very closely. And then we also expect that this time commitments will be launched in country, not at a global meeting, but among all of you. And that globally, then you'll share those commitments with all of us when we get to ICPD or ICFP in November of next year. Next slide, please. I'm just going to quickly touch on the fact that we hope that all commitments will consider rights-based family planning, ensuring that adolescents and youth are considered in the commitment, but also part of the commitment processes, that financing is there. You're thinking about supply chain strengthening, that you're looking at preparedness planning, which is more important than ever. Now we've seen with the global pandemic, considering integration of sexual and reproductive health services, including HIV integration, and looking at really promising practices like postpartum family planning. Next slide, please. So I'll stop here with this slide because this is just for us the way forward for the partnership, that we'll be finalizing this global framework for accountability to ensure that that's a lot clearer.
We'll be looking at how we can have stronger support for civil society focal points and other civil society actors who are engaged in this partnership using a differentiated need model across the partnership. We're hoping to support governments and donors to engage in the commitment-making process and continue to assess the impact of COVID so that we all understand what that evolving landscape is, country by country and region by region. So Onyinye, with that and the last slide, I just want to say thank you for that. And back over to you for the Q&A.
Thank you, thank you. A round of applause for Beth. I'm sure I can't hear it over here, but I'm sure you're all giving her a rousing round of applause where you are. So I want to thank all of our speakers for all they have said and shared in this discussion. I know we're running behind time a bit, so I want to give us a chance to at least respond to a couple of questions. Dr. AGK, I don't know if there are questions in the audience, but we did see one question in the virtual chat box from Elvis Okoli. And this question, I would direct this question to Dr. Afolabi. Elvis is asking, in the revision efforts directed at FLHE, what is the level of engagement with the parent-teacher associations? Dr. Afolabi, are you able to respond?
Yes, thank you very much. And I thank the participant that asked that question. Yes, we'll be engaging with all stakeholders. We, like I said earlier, we have just started, just initiated the process. So we consider the Parent and Teachers Forum to be key stakeholder in this process because we want what will be culturally acceptable to everyone across the country. Otherwise, it might suffer a similar challenge that we had witnessed in the past that almost got the whole process aborted. So that is a block of key stakeholder that I'll be engaging with along with other stakeholders. Thank you.
Thank you so much, Dr. Afolabi. And maybe we can get a signal for how many, maybe we can take maybe one more question because we definitely want to be mindful of time since this is a hybrid event. Ensure that the next session starts early. Dr. EGK, what do you think?
Yes, I have two questions, but since you say we can take one, let me read. Dr. Afolabi, this is for you. Does the Green Dot campaign cover all the 10,000 PHCs mentioned in your earlier presentation? If so, any updates on the utilization of services so far, especially during the COVID-19 pandemic lockdown? It says, does the Green Dot campaign cover all the 10,000 PHC facilities in the country mentioned in your presentation? If so, any updates on the utilization of services so far, especially during the COVID-19 pandemic lockdown?
Well, thank you, Dr. GK. The Green Dot, our national family planning logo, does not cover all the 10,000 PHC facilities we're talking about. We've only got limited funding support to provide this site identifier, with the national logo. So we need to do a lot more in that regard. As to the impact of COVID-19 pandemic on service provision, this was quite very great, especially at the beginning of the pandemic when there was a lot of confusion, not only in Nigeria, but across the globe. And virtually every sector was severely affected. But we quickly responded to mitigate this COVID-19 impact by ensuring that we made sexual and reproductive health services, as well as maternal health services, essential services in the country, and special considerations we're giving to service providers, including those who are involved in supply chain, for them to be able to function even despite restriction in movement across the states. And we were able to get the RMSCAH and N plan of action to be part of the national response to COVID-19 pandemic. So we got services to improve rapidly after we commenced this. And in fact, some facilities and also some franchises of our partners demonstrated increased service provision at a point when this response to mitigate against pandemic had been put in place. So we have been able to overcome that particular challenge, but we are not unaware of the second wave of COVID-19 pandemic, especially in Europe and America, and we shouldn't relent in our infection prevention and control measure. And we should also be prepared in case there has to be some other responses that may want to adversely affect service provision. We should be prepared to be innovative in this regard. Thank you very much.
Thank you so much, Dr. Afolabi. And if I may, just one question that I hope to get a response from Dr. Afolabi as well as Beth. So there's a question we've heard from a few of our focal points around the world, and it's about the recommitment. So what if Nigeria has not accomplished some of the goals from the previous commitment? Are you expected to keep the same goals for the post-2020 partnership, or will you come up with entirely new goals? And I also would like for Beth to address this question about, are countries expected to come up with new goals, or what should they do with the old goals that have not been achieved? And we'll wrap up with that.
Yeah, sorry, Onyinye, we lost your audio briefly. Can you just recap that question, please?
Oh, yes, sorry, can you hear me now?
Yes, please go ahead.
Okay, yes, so the question is about the recommitment process. So we've heard from a few of our focal points about what if your country has not accomplished some of the goals, the current goals that you have from the previous commitment. Can you keep the same goals going into the next partnership, or do you need to come up with entirely new goals? And I would love to get your perspective from the Nigerian government's point of view, and also hear from Beth as well.
Okay, thank you very much. I think it's going to be a mixture of the two. There will be some commitment that we like to retain the goal. For instance, we have revised the National Family Planning Blueprint for 2020 to 2024. And the target we have there is still the 27% MCPR, because we considered all the data we have at our disposal, and the improved and enabling environment that has been created. So we are projecting that we should be able to achieve this 27%, even though it is very, very ambitious. So we'll be retaining that particular target as part of our commitment. But there are some other commitments that we are looking to opportunities to improve on them. For instance, the financial commitment, as well as service provision commitment with respect to the service delivery points and the available as well as distribution of skilled service provider. We are working to improve on such commitment with further expansion of the tax shifting tax sharing policy. Thank you.
Awesome, thank you. And Beth, really briefly.
I would just add that that's an excellent example of what we're encouraging all country partners to consider, is just what's worked in your last commitment, what more do you need to carry forward, and are there new areas of work or things that we've learned along the way that could add some more nuance or greater tools to be able to achieve even more. And so I hope that, we won't have achieved the FP2020 goal either, but that's not going to stop us from going forward and to continuing to try to reach all of the goals that we set for ourselves for 2020. So that hybrid mix, just like a hybrid conference, is you take what you've learned, you take what you can do, and you move forward. So thank you very much, Onyinye, and thank you, Dr. Afolabi.
Awesome. Thank you all. Thank you all. Please, I hope you can clap from wherever you are. This has been a great discussion, if I say so myself. I hope you all have learned a lot and also gained some additional insights as to what comes next. So without much delay, Dr. AGK, I turn it back to you. Thank you so much, Beth. Thank you, Dr. Afolabi. Thank you, Dr. AGK. Thank you,
everyone.
Nigeria. Enjoy the rest of the conference.
Thank you, Onyinye. Thank you.